Welcome to What Would Sabrina Say? I'm Sabrina Dong, and I'm excited you're joining me today. In this podcast, I dive into mental health topics on relationships and overall well-being. With over 20 years of experience as a licensed clinical social worker, I share insights and invite expert guests who are passionate about making a positive difference. I started this podcast because I was frustrated with the often misleading or recycled information in social media involving self-help and the mental health field. My goal is to provide you with genuine, useful content that's educational and informative. Thanks for tuning in. I hope you find our conversations both enlightening and empowering. I'm glad you're here. Hi, welcome to What Would Sabrina Say? I'm your host, Sabrina Dong, licensed clinical social worker. Today I have with me here Tom Herbetko. He is a osteopath and has a lot of great expertise training globally on different areas like vagal tone and fibromyalgia, what we're talking about today. Thanks so much, Tom, for having you join me all the way from Spain.
Hi, Sabrina. Thanks for having me. And it's great to talk to you again after 20-something years.
Oh, amazing to reconnect and be healthcare providers in a different way and cross paths again. Yeah, congrats on everything that you're doing. So I'd love to hear about the role of an osteopath, what it is that you do, and the importance of about vagal tone and what that does for people. And we talked about, the pain and discomfort that can come along with some of these illnesses that people experience too.
Yeah. So fibromyalgia is a very common occurrence, especially these stress-filled days. So fibromyalgia basically mostly affects women, but actually 1 in 10 cases will be men. So why is that the case? It's mostly estrogen, fluctuation in estrogen and lower testosterone levels. So it could also affect men because of lower testosterone levels or estrogen dominant in our processed food and stressed lifestyle. Yeah. So fibromyalgia is a patient that I see quite frequently in my clinic because it is chronic pain. So patient will come for, I would say, about every month, every 2 months for a treatment, and they will feel okay. But obviously, fibromyalgia is a multi-factor disease and also needs a multidisciplinary approach. So one of the most common things that we have to convince the patient to do is to change their lifestyle and to work on some past emotional traumas and the stress levels, which is really easily measured now with vagal tone, with heart rate variability, what it's called. So I don't know if, Sabrina, you've seen these straps that they're called polar straps. Some people have them on their smartwatches. They have heart rate variability. But basically, that will measure how you respond to stress. So previously, we always were thinking about, or the theory was that in the autonomous nervous system, which is our primitive nervous system, reacts to fight or flight in case of sympathetic tone, and rest, digest, and sex in parasympathetic tone, where the vagal nerve is the main nerve in this case. So we always used to thought that there was a kind of like battle between them. When there was a high sympathetic tone, there would be low vagal tone, and vice versa, like kind of like seesaw. But that's not really how it works. So basically, the good news is we can work on our vagal tone. And working on our vagal tone and having a high vagal tone or high vagal response, when we do encounter stress, which we do every single day in our lives, a person with high vagal tone will return really quickly to homeostasis. So there will be lower inflammation markers, there will be better sleep, less pain, less bruxism, which is clenching of the teeth at night, for example, and of course, digestive issues. Yeah, because when there's a high sympathetic tone, the digestive system doesn't work properly. You either have to fight or digest, one of the two.
So when I picture vagal tone, and I'm wondering, how do you get that up? Does that have to do being less sedentary? Sorry to cut you off, but I was just imagining or thinking about the ways of getting that up.
Excellent. Yeah. It's very important to right away talk about how we can raise the vagal tone because sometimes we cannot handle our boss or a divorce in that way. But if we do have some exercises, for example, breathing exercises, So breathing in a rhythm of 5 and 5 or 5.5 seconds inhale, 5.5 seconds exhale. Now you would have to either choose to inhale and exhale 5 seconds or 6 seconds because you can't count in the middle, right? I choose 5 because it's my favorite number. Generally, we should have about 5 to 6 breaths a minute to raise vagal tone, to raise this heart rate variability. And most people actually breathe up to even 25 times a minute, which is highly oxidative and damaging. And another problem is mouth breathing, for example. When you mouth breathe, we don't have any vasodilation effect. We don't have an immune response. I imagine somebody coughs. Well, if you're a mouth breather, you probably get sicker faster than somebody that's a nose breather, just for an example, because of this vasodilation and this immune response. So slow breathing is very, very, it's probably one of the top markers which I do, or top treatments. And I also recommend it inside the clinic to teach this rhythm. We should actually do it just before bed if you're a bruxist. So 10 minutes of 5-5 breathing is excellent. Other ways to increase vagal tone, of course, is through exercise and movement. Other exercise, which is very important for lowering this or raising this vagal tone and having a better stress response. There are many other ways. For example, not eating sugar. Sugar is one of the most common culprits in our lives, and especially liquid sugar. So, for example, cola and juices, which go directly, we could say, to the bloodstream, right? Because there's no fiber. It just gets absorbed right away. So there's a very high glycemic response. And when there's a high glycemic response, it's been known that you actually 2 hours afterwards, you have a very low vagal tone. So after eating sugar and having this glycemic drop because of high glycemic foods, you will actually have a low vagal tone, which also will increase cortisol and the stress response. So a lot of times people will eat sugar because they will be stressed in general. So, for example, imagine a person who's breathing very quickly. He's very stressed out. And then when that sugar drops, which actually gets maintained, because what cortisol does is goes to the liver and it stimulates gluconeogenesis. So it releases sugar in your bloodstream. Because your body thinks that there is danger. For example, I don't know, let's say a wolf that's going towards you, right? Unfortunately, with chronic stress, like your boss or like your partner or your child, we are constantly thinking we are in danger. So we're always raising these stress levels. And then in the end, this high sugar and blood sugar will actually lower quite quickly. So you will actually look for sugary foods to try to balance this drop in sugar. But that's not the answer. The answer would be actually with breathing exercises, control the stress. You might want to concentrate on exhaling, longer exhale, especially if you're having stress or pain. So pain is also kind of similar to stress, and it's managed by the prefrontal cortex, which will decide how your body will react. Also, vagal tone can be increased with things such as singing or humming. And also, as I mentioned, the Asians, they would hum, the mouth breathing. So tongue placement is also important, like improper tongue placement. Like if a lot of people with their mouth breathers, they have a lower tongue position, which is not the resting tongue position. So they will always be increasing their sympathetic tone. And interestingly, for example, just to give you an example, like the importance of mouth and nose breathing, well, when they did a study in 11 and 12-year-olds and they did an IQ test on all these children, they've even realized up to 30% more intelligence in nose breathers, right? Because there was better oxygenation of the brain. So that's why it's really important. Like if you have children, if they get sick, a lot of rhinitis or sinusitis and these kinds of problems, that we retrain them to nose breathe. For example, now it's really popular taping or just education, right? Than that. What else? How can we, well, as I said, humming or singing, because you're actually stimulating the vagal nerve when you hum, especially like, for example, when I get really stressed out, I tend to lose my voice because because of the vagal nerve, which innervates the the speaking muscles of your throat, coracoids muscles. Yeah. And so humming would be a great way. And also sleep is very important. Sleep, getting deep REM sleep. Try not to have any stimulants before going to bed. Going to bed quite early with the circadian cycle. So basically, trying to get those lights, those blue lights out of your life. Not looking on your phone, because if not, you will go to sleep with a low vagal tone. Right? It's been proven that, looking at your mobile just before sleeping will disturb your sleep cycle, for example. But since I am a manual therapist, we talked about the nutrition a little bit and so on. One of the great effects that this vagal tone can be affected is with the fascia, right? So the fascia is really getting researched, and it's not a new discovery. We've been doing it for years. We've been treating the fascia, but I think that the fascia is the treatment of the fascia is the future.
Well, what treatment look like, or when you talk about manipulation?
Okay, so let's just go back to the fascia. What is the fascia? Because the fascia is actually, I always joke around, somebody who studies fascia is fascinating. Yeah, so. But fascia is fascinating, actually. It's one of the most sensitized parts of your body. So actually, we can talk 30 days about the fascia, but let's get into just a little bit about some details. First of all, it's where most free nerve endings are. So fascia has all these mechanoreceptors. So anytime you touch somebody, you will feel that person will get this response for either pressure, heat, or some kind of chemicals. And since the fascia has so much of these receptors, imagine you injure your hamstring, and usually the hamstring takes about 6 weeks to recover. But about after a year, or even after 2 years, or even after 30 years, you still have pain there, right? That's not the muscle that's actually sensitized, but that's the layer that covers the muscle, which is the fascia. And the fascia is a really intelligent system that was once thrown out by surgeons. And they used to cut it. They used to not care about the fascia. And it was studied in dead people, right? In cadavers. Until we actually had this technology where we can look with microscopes and look inside the fascia and see how it moves and see how it acts. And it's just really, really fascinating. Fascia has one of the highest proprioception. So let's just say balance. So we know that with aging, balance is lost. The fascial continuity is altered. For example, in cases of scars, lesions, or emotional trauma. And fascia is really, really important in this action with traumatic experiences, because fascia is sympathetic. So going back to the vagal tone and so on, the fascia responds with a sympathetic tone, with an increased sympathetic tone, presenting that there is danger, for example, because you need to protect. You need to protect everything. You need to protect your organs. You need to protect your muscles when you are in quite a lot of danger. And this fascia tone, the sympathetic fascia tone, when we're constantly stressed, we're also going to be feeling tension in different parts of our body, even if they're not injured. So non-chronic trauma, especially with emotionally related, because we always say that fascia traps all these emotions in our body, and you do feel it, right? You can feel like sometimes anger in different parts of your body, or no, I don't know, high tension in your occipital area in your skull. And fascia has this proprioceptor, so it is spatial awareness, but it also has interoception. And interoception has been very studied now, because we know that people that are depressed have very low interoception. And fascia is one of the most interoceptive organs that exists. It basically conveys information to our brain about what's happening in the body. And your body and your mind, your brain will start to process this information very quickly, because fascia is a lot faster than nerves. Okay, so it moves at the speed of sound, and even with the new theories, even at the speed of light. So it's instantaneous. There's a reaction. So imagine your ex-boyfriend walks into the room, your reaction is going to be right away, your fascia tenses up. Or another example, somebody throws a ball at you. Before you react with your hand to block the ball from hitting your face, first thing you will do is you will tense, and then you'll raise your hand. So the nerve response is actually a lot slower, and the fascia is a lot faster. And we know emotions are instantaneous and instantaneously felt in different parts of the body. So the fascia is really responsible for pain, for perceiving pain more than anything, for perceiving your spatial awareness, your balance, and also for how you feel with the interoception. And with depression, we know that interoception is very low. With anxiety, it's heightened. And so often these patients will go between heightened and low interoception, and they will feel their body the way they should, which is good. Feel it well, right?
As a trauma specialist, I'm always talking to people about how we carry trauma in our body, right, and where we experience it. And it's great to understand from your area of expertise where we're holding it and how that message gets transmitted to different places and parts. And the benefits of breathing, I think a lot of times we talk about it and people just shrug it off because we are breathing all the time. And it's just something we do naturally. So does it feel like it's a way to help regulate that nervous system, help reduce that stress? And for you to bring out in the research the facts, it's really exciting to hear, backing up sort of what we talk about in the area of mental health.
Excellent. Yeah. Yeah. There have been a lot of these. I don't know if you've seen these drawings of how people feel different pain in different parts of their body. And those are their fascial responses. The body travels in lightning speed and conveys messages. Like, for example, when a patient comes to my clinic, I will get to know just through the posture what kind of feelings they're predominating, right? When a depressed person will have lower position of the diaphragm, will have this kind of hunchback position, whereas a person that's in higher stress mode will probably be in more of a military pose and will be in defense mode, right? But what happens with this vagal tone, when it's lowered for some time, then eventually depression will win over because your body cannot handle this excess stress. And this is what happens a lot after trauma. You will see these, for example, one very common thing is lower back pain, right? We now know that lower back pain is not caused from, for example, which is quite misdiagnosed with hernia or spinal issues as so much as a thoracolumbar fascial area, which kind of connects with all the fascias. I look at the patient. I will look at emotions are very important in how the body perceives pain and so on. So the Chinese, for example, they know that when there's a person that's suffering from grief, they will have lung problems. Yeah, and that's quite scientifically proven. Also, you've heard the whole saying of dying of sadness. So actually, in medical terms, that's dying of respiratory insufficiency. So yeah, the different emotions will affect different parts of the body or will predominate in different parts of the body. We know that alcoholics, they are quite angry. So we know that the liver, and if you go out at 2 o'clock in the morning, go out clubbing or whatever, you'll see a lot of fights, a lot of angry people. Well, a lot of livers are not working in that moment, right? So this anger, this war zone enters. And we know now with politics and stuff, there's a lot of people with angry livers, maybe eating too much McDonald's.
So what we put in our body, I'm talking to clients about, we look at food for mental health, right? The ultra processed foods. There's no nutritional value. Nothing that you're putting into your body helps. And so hearing other ways that your body's affected by processed food. We hear a lot, I think, about the heart and liver, but not so much about anywhere else, like the brain or other parts of our body that are impacted by the lifestyle. If we're too sedentary, how that affects our body. When we talk about stress, emotions, what we eat, it affects so many other of the parts.
Exactly. One of the most important things I haven't touched on yet, but that's probably the most important that's been getting discovered is this gut-brain axis, right? We've I wouldn't say it's a recent discovery, but recently proven discovery. And now there's so many scientific articles coming out on every single aspect of it. Even the vagal nerve, which innervates all the viscerals, all the organs in the body, has receptors for different types of bacteria. So the most important thing is the microbiota, to having a healthy microbiota, not eating processed foods, not stressing out too much. Sugar has to be eliminated, all the good stuff, right? And we can improve this microbiota by also through many factors. Actually, microbiota is quite damaged from the early age through antibiotics. We know that just one cycle of antibiotics can destroy certain strains of bacteria that exist in your microbiome. And we know that, for example, children born with the C-section, right? So when a baby comes through the vaginal canal, well, the first microbiota that it absorbs, because it's born without, is through the vaginal. So if the baby is born with a C-section, it will not absorb these important microbiomes. Milk, feeding with breast milk is also a great way to improve microbiome. And women that feed with breast milk also improve, of course, microbiome of their children. And like I said before, not taking too many unnecessary antibiotics. Sometimes your life depends on it. But there's overuse, obviously, of antibiotics, and there's antibiotic resistance, which is the new pandemic that's going on in the world, which is quite scary.
It's really great hearing and understanding about fibromyalgia. I think up until the recent years, it's been an umbrella term for people who experience pain in certain areas and not being sure to connect it to where and why, linking it to trauma or mental health symptoms that people may suffer from. Now it's that we're understanding more about the vagal tone, fascia, and how that all comes into play, and how people in your profession can even help people with these conditions and improve.
Yeah, exactly. I mean, the vagus nerve, the trajectory is quite interesting because it comes out from the cranial area. Okay, so between the occiput and the mastoid process, and it actually comes out with another nerve, which is quite common in stress. When we see people that are having a lot of stress, they'll have the higher shoulder position, right? They'll have a lot of trapezius tension. So trapezius muscle has its own cranial nerve, so it's so important. And many people wonder, why do you raise your shoulders when you're stressed out? Well, if you watch any documentaries about the Serengeti, and when the zebra crosses the lake and the lion gets him, where does the lion go? Well, it goes for the neck. So, so we raise our shoulders to protect, and that's also where the vagus nerve comes out of. So the vagus nerve, the trapezius can be like another indicator of low vagal tone if there's a lot of tension there, because there is these fibers, they cross within each other. So neck is like one of the places where we protect, is the second actually after the cranium, where it will go through the sternocleidomastoideus muscle, and it'll go just behind it in the carotid sheath, and it will run into the sternum area. So that's why sometimes you will have, for example, people experiencing anxiety, they'll have a lot of tension in the neck, in the sternal area, or especially in the occipital area, which is also very common in high tension, high blood pressure. And now there's another factor, there's the trigeminal response. And we know bruxism, or teeth clenching, is very common, especially with stressed out people, or people suffering digestive symptoms. For me, there's no difference. Okay, that's the same thing. So there is a very direct correlation between digestive problems and bruxism, because when your digestion doesn't work, it means the fight or flight is very high and your vagal tone is low. And there is an anastomosis between the trigeminal nerve and the vagus nerve in two places, one inside the brain, which is nucleus anastomosis, which is like the connection, and another one in the upper cervicals. So a lot of times people will suffer from upper cervical pain and occipital pain because of this connection and this crosstalk between these nerves. They're always talking and connecting and talking between each other. There's a language going on there, which is amazing. So we will have teeth clenching in people with, for example, fibromyalgia. Yeah, with fibromyalgia, or with any other digestive disorders, like I've been recently doing a study on acid reflux, and then with neck tension and with mouth opening. And we've noticed that there is a significant improvement in mouth opening and neck rotation after stomach treatment, for example. So all of the patients have given up on very dangerous drugs like omeprazole or proton pump inhibitors, which cause a lot of side effects, very deadly side effects in the future.
We talk to people about mindful intuitive eating. We say the digestion and eating starts with the mouth, right? Digestion actually starts there, right? Orally and before it hits your stomach, right? So we're teaching people to learn to eat like they're toddlers again and pay attention to their bodies and hunger cues. And we do talk about noticing what's happening in your mouth and your face, right? And that's starting at that experience. So it's all about being present. And so to learn about validating that the whole system's connected there. the stressor and where it comes out, right?
Sure.
In your jaws, in your
Exactly.
stomach. But gosh,
Eh,
we touched on so much and learning so much from you today. Love to have you back, especially to talk more about, vagal tone. I think we probably just touched the surface of the vagus nerve, even about fibromyalgia. And I know there's so many people out there who suffer from it. So we'd love to have you back and even to talk about hormones. I think it's so important. And that's something that we tend to not understand how they work, although we know it's important and what they do. So appreciate your time. And yeah, thank you so much. Learned a lot.
Thank you so much, Sabrina, for having me. It was a pleasure, and I hope to be back. I hope to connect with my North American new audience.